So, after how long should somebody do a pregnancy test after having sex? That is what we're going to discuss in this video. So, in the African setting, when a parent catches you or you get caught having sex with their daughter, they usually take you to the clinic and they do two tests. The first test they do is a pregnancy test, and the second test they do is the HIV and AIDS testing. But the most important test which they insist that should be done is the pregnancy testing. So when you are unlucky and the pregnancy test turns positive, that is when they take you to the police station, or they take you to the chief, or they take you to the relevant authorities. But when you are lucky enough that the tests turn negative, some of them might opt to forgive you, or some they might just give you some beatings. They can just beat you, or they give you warnings and they just release you. But the moment they find that you are pregnant, most of the time that is when they take you to the authorities, or they take you and report you to your parents. In another setting, you find that we have people who do the long distance relationship. So it might be because of work, it might be because you are schooling, or it might be because of different circumstances which makes you not to be together in that relationship. So you find that one of you is operating, let's say in Nairobi, the other one is operating from Kisii. So it might reach a point whereby you find that your girlfriend insists that they want to see you. Yes, they want to see you. So when they want to see you, because you are their boyfriend, you cannot deny them. So they come and visit you. And when they visit you, obviously you will have sex that day. Then the following day, they wake up and they do a pregnancy test. And they tell you, guess what? I am pregnant. So I'm going to discuss if it is possible for the pregnancy to be detected during the first day, or the correct timing whereby it is possible for the pregnancy to detect, if it is truly right that it can show that they are pregnant, or probably maybe there's something they're not telling you. In another setting, you find that we have parents, we have people who are trying to conceive. Maybe they are dealing with fertility issues. They have been trying to get a kid, but it is becoming hard for them. So most of the time, you find that because of their eagerness to get a kid, you find that they keep testing each and every day. The first day they test, the second day they have sex, they test, they keep testing and testing and testing and testing. And you'll find that at the end of the day, because of the increased number of testing, you'll find that you will spend a lot of time purchasing the pregnancy testing kits, or going to the clinic so that you can be performed a pregnancy test. So I'm going to discuss the correct timing, with the timing which then amount of time which you need to wait before you go and do a pregnancy test, so that it can save you a lot of time. Instead of you testing each and every day, you can just wait, or you can just wait for a bit of time. You can just know the correct time, the right timing, and the right time to do a pregnancy test after having sex. So welcome to my channel. My name is Maxwell Abwire, for those who are new to my channel, and in this channel we discuss about different medical topics. So if you have not subscribed, you are missing a lot. You are missing and missing and missing a lot. So just remember to subscribe if you have not subscribed. And if you are new to my channel, this is a channel which you can call home. You can come here so that I give you information on different aspects about your health, which enables you to make informed choices and decisions about your health. So welcome, like, share, comment, and subscribe. And let's get started to the video of today. So welcome. Remember to subscribe, remember to like the video, and remember to leave a comment down in the comment section below. So let's get started with the video of today.
I be so sick of you niggas, y'all contradict me. I be so bored myself when you come and fuck me. I feel so ordinary, except when you around me. Treat me like corduroy, you wear me out. Arguments, you air me out. Tripping about you.
So welcome again. So first of all, let us look on how pregnancy occurs. So pregnancy occurs the first thing you need to do is to have sex. So when you have sex, the sperms will be ejaculated and be released to your vagina. And immediately the sperm starts the journey of moving, looking for the egg, whereby they go through the cervix, they pass through the uterus, they pass from the uterus, they go to the oviduct, out the fallopian tubes. In this video, when you see I mention oviduct, just know that I'm mentioning the fallopian tubes. So when they reach the fallopian tubes, they are looking for the eggs. So the eggs usually are released to the fallopian tubes. They are released from the ovaries, then they are they start moving towards the uterus through the fallopian tubes. So the sperms move towards the fallopian tubes as the eggs move from the ovaries towards the uterus, passing through the fallopian tubes. So when these sperms do not find the ova in the fallopian tubes, they wait for a period of 3 to 5 days. That is when they stay there for a period of 3 to 5 days, waiting for the eggs to come so that fertilization occurs. When the ova does not come within 3 to 5 days of sperms being deposited, of the sperms being in the oviduct, the sperms will die and they will be absorbed by the female reproductive system. So when the sperms find the ova in the fallopian tubes, fertilization occurs. Fertilization is the fusion of the sperms and the female eggs. When fertilization occurs, there's a formation of something called the embryo, which is the result of fertilization. When the embryo has been formed, the embryo will now start the journey of moving from the fallopian tubes towards the uterus. And when they reach the uterus, the embryo sticks itself at the walls of the uterus. Remember, the uterus is the place whereby your baby will need to grow. That is why we call the uterus the womb. So fertilization cannot occur in the oviduct, because when it occurs in the oviduct, implantation does not occur in the oviduct, because when it occurs in the oviduct, it will result to something called the ectopic pregnancy, which is a high-risk pregnancy, which can poses a lot of risk to the health of the mother. So this embryo will need to be to implant or to stick itself at the uterus so that it can start to grow. That is when now the placenta starts being formed and your baby now starts to grow. Secondly, let us look on how we do a pregnancy testing. So we have 3 types of pregnancy testing. We have blood testing, we have urine testing, and we have the ultrasound. And in this circumstance, we will roll out the ultrasound because it is not easy to detect the presence of a baby using an ultrasound early in pregnancy. So we remain with 2 testing tests. 2 tests. We have the blood testing and we have the urine test. So the blood testing and the urine test usually utilize the same principle of testing. They usually test the presence of the human gonadotrophin hormone. So this hormone is usually produced immediately after implantation. Implantation is the sticking of the embryo at the walls of the uterus. So immediately the implantation has occurred, that is when the human gonadotrophin hormone starts being released. And it is after implantation that is when you can say that you are now pregnant. And that is where the testing kits can detect, they can turn positive when they detect the presence of this hormone. So let us now go to the question of today. After how long is somebody able to detect a pregnancy? After having sex. Remember, our timeline is after having sex. So after how long will somebody be able to detect a pregnancy after having sex? So first of all, when you have sex, when the sperms have been deposited in the vagina, it takes a period of between 5 to 20 minutes before the sperms move from the vagina to the oviduct. So after 5 minutes, if the sperms are quick enough, if they can swim as quickly as possible, it will take just 5 minutes before they go to the oviduct or the fallopian tubes. So when they reach the fallopian tubes, let's say ovulation has already occurred, and the sperms and the eggs are in the fallopian tubes. So immediately they reach the fallopian tubes, the first sperm that comes in contact with the ova is the sperm that will fertilize the ova. Yes, the first sperm, if we only need one sperm, and we usually ejaculate millions and millions of sperms. But the first sperm that comes in contact with the ova, that is the sperm that fertilizes the ova. So fertilization occurs instantly. Just the first contact, the ova and the sperm they meet, fertilization occurs instantly. So after fertilization, there's a formation of the embryo. Remember, I've mentioned the embryo. Now the embryo will now start to move from the oviduct to the womb, because it is in the womb that is where it needs to grow. It cannot implant itself in the oviduct because it will result to something called the ectopic pregnancy, which poses a high risk. It is a high risk pregnancy which poses a lot of health risk to the mother. Most of the time, this pregnancy will need to be terminated. So the embryo will start the journey from the fallopian tubes towards the uterus. So the journey between the place whereby fertilization has occurred in the fallopian tubes and the uterus, the place where implantation has to take place, usually takes a minimum of 6 days and a maximum of 12 days. So if the embryo is fast enough, it will take a period of 6 days. But in most circumstances, most circumstances, it takes a period of 10 to 12 days. That is normally it takes a period of between 10 to 12 days for the embryo to move from the fallopian tubes to the uterus. So when it reaches the uterus, that is when implantation occurs, and that is when the human gonadotrophin hormone starts being produced. That is whereby you can do a pregnancy testing and know that you are pregnant. So we have said that the journey of the embryo moving from the place where fertilization has taken place to the uterus will take between 6 to 12 days. So when it reaches the uterus, implantation occurs, and that is when the human gonadotrophin hormone starts being produced. So this is the moment whereby when you do a pregnancy testing, that is when you can realize that you can detect that you are pregnant. When you do a blood test during this time, there's a high chance it can detect that you are pregnant. But when you do a urine test immediately after implantation, it might turn negative, because there must be a high concentration of the human gonadotrophin hormone in blood before it starts now being detected in urine. So for those who use the urine testing, you will have to wait for some few days before it can show that you are pregnant. So the question of today: what is the earliest time that you can do a pregnancy test and it shows that you are pregnant? So first of all, let us use the 6 days, because we have said the journey takes 6 to 12 days. On the minimum end, we have 6 days. And if the journey of the sperm from the vagina to the oviduct, if it is quick enough, it will take 5 days. So the earliest for you to test a pregnancy, for it to detect a pregnancy, using the blood test, because the blood test is the most accurate one, will be 6 days and 5 minutes. On the other end, we have 12 days and 20 minutes, whereby 12 days is the journey between the embryo moving from the oviduct to the uterus, and 20 minutes if you have slow sperms. So it takes a lot of time for the sperms to move from the vagina to the oviduct. So we have two ranges. The earliest you can detect a pregnancy is after 6 days, 5 minutes, and the latest, if you have a slow sperms and the embryo was much more slower, it will take 12 days and 20 minutes. So the earliest you can detect a pregnancy will be 6 days and 5 minutes. So in the early example whereby I told you that when you do a pregnancy test immediately after sex, the chances of you detecting a positive pregnancy test is is negligible. You cannot get positive results after sex, immediately after sex. Um, if you find that you have tested and you have found that the lady is pregnant after sex, there's a high chance that pregnancy was not caused by that moment you had sex with that lady. The lady or the girl probably was pregnant before you having sex with them. I hope you have understood up to there. I know it's very hard for me to explain without using a diagram. So it's somehow challenging for me, but I hope you have understood up to there. So the earliest you can detect a pregnancy is after 6 days and 5 minutes, and that is if you have accurate testing kits. But for those, this is for those who are dealing with fertility issues, or if those who want to get accurate results for pregnancy. If you want to get the sure and accurate result using the urine pregnancy or for pregnancy, do the urine testing after 14 days. And if you are not sure about the results, you can repeat the test after 21 days. So somebody telling you that they got pregnant immediately after you had sex with them, that person will be lying to you. So with that said, I've come to the end of my video whereby we have explained on the minimum number of days it takes for pregnancy tests to turn positive after pregnancy. And you also need to remember that the sperms might wait for the ova for a period of 5 days. We have not put that into consideration because we have not counted the 5 days which will the sperms might wait for the ova to for the ova to be released. Because under normal circumstances, this is not always the case. We have based this calculation based on if the lady has ovulated. So we have found that the number of days, the minimum number of days or the number of time which a pregnancy test, if it is accurate, if it is more accurate, will detect a pregnancy is after 6 days and 5 minutes. But the urine testing might not detect the early pregnancy, because you need to give room for the hormone, the volume of the hormone in blood to increase before the volume of the human gonadotrophin hormone can be detected in urine. So with that said, I've come to the end of my video. Wish to remind you to please subscribe, to like the video, and if you have any question or if you have any clarification or if you have anything you want me to talk about, please put it down in the comment section below. So with that said, bye bye for now. Let's meet in my next video.